Anya, that doesn't sound good.
Yeah, I think I have a strep throat.
Did you hear about the new CHOP telehealth that we have downstairs in the nurse's office?
No, but I think I have to check it out.
Check it out with this next video.
Telehealth is the ability to have a provider take care of a patient when they're not standing right in front of them. So, yes, it's great to be able to have a doctor in person take care of a patient, but if they can't get to that doctor easily, a lot of times they'll skip doing that doctor's appointment.
We allow the nurse to bring in a student. If the student comes to the office and has an illness that's appropriate for telehealth and they're enrolled in the program, they will call me up or one of the other doctors that are on call back at Children's Hospital, and we can do a telehealth visit.
We can get the care to the person where they are without making them go through additional burden of having to travel to a location.
The telehealth project started last school year, and the high school was one of the schools to be in the pilot program.
Last year, we were fortunate that CHOP reached out to us to do a 3-school pilot, and it was so successful. We worked with them and said, wow, like how can we have the success of this be replicated in all 12 of our schools?
CHOP and the Norristown Area School District started this partnership where they started the conversation of what would a program look like. And it's been over a year now. We did a pilot last year in 3 schools just to be able to test and make sure technology worked, make sure we were able to train up folks on this end on how to use their technology here.
We actually practice with staff members and we practice with each other.
And train our physicians on the CHOP end on how to receive these telehealth visits.
The doctor side's great. I get a little text on my phone to say a student is ready, and I go on my computer and I see one of the school nurses like Donna Gill at Norristown High School with a student that might have a rash or have a problem, and we can just talk just as if we're talking on FaceTime or any kind of video conferencing.
Nurses treat, nurses don't diagnose, so that's where the pediatrician comes in play on the telehealth visit. The doctor would diagnose a skin infection that we possibly would exclude the student for, send them to their own doctor. Also, the doctor could diagnose an ear infection, not necessarily a strep throat, but could also rule in or rule out a strep throat and know when to refer that student to their doctor if it's something that couldn't be handled over the telemedicine visit.
So if you're talking about rural patients, it's very difficult to find specialists in their area, or it's difficult to get to a healthcare center. If you're talking about urban, you still have similar challenges of multiple buses and subways to get to the doctor's office. So whether you're a rural patient or an urban patient, making it easier for them to get care, stay on their care plan, and interact with their providers. That's our goal with telehealth. We're doing it with technology. We're talking about video visits where you're having live conversations. We have peripheral devices, tools that help us with our exam, help be able to look in a patient's ear, look down the throat, that sort of thing. So it's really about how can we get the best care where the patient is when they need it.
Well, more than anything else, I think it's important as a parent. This is a way where our kids, when they need health care, can get it almost in a real-time basis. The school nurses do an amazing job, but obviously there's a threshold of care that they're able to provide. This really takes it to the next step where a doctor from a premier health system in the region can provide real-time care, make a decision about whether that student can go back to class or frankly mom and dad need to come, or in some cases actually write the prescription so that mom or dad can pick up that prescription after work and kind of close the care continuum.
If the student has an earache, she has a device and the ability to show me that student's eardrum, which is really very bright with a light, and it's magnified, and I can see the eardrum really clearly. I can also look in their throat and see a great view of the throat, and I can tell if it looks red, a little inflamed. I can look if it might need to go in to be seen to somewhere to get a strep test. I can also listen to lung sounds and hear whether or not they're wheezing if they have a bad cough. So I can do all of that from all the way back in Philadelphia from my desk at Children's Hospital.
So the equipment we use when we're working with our patients and we have our physicians over at the CHOP office, it's actually something that's safe and secure. It's HIPAA compliant, it's FDA approved, and it's integrated within our Children's Hospital electronic medical record. So it's the same medical record that we use for our patients that we see every day and for those who come into our specialist office. So it's something that's safe and secure with your patient's data and information.
We're looking forward to telehealth visits at the high school for a student to see the doctor via the telehealth visit on the iPad and the TITO equipment. And then if it's something that the student can be diagnosed over the telehealth visit and medicine be prescribed, that student could stay in school.
Not only are the pictures so clear and the Wi-Fi so strong that I can have a really good interview, so I could certainly do psychology or or talk therapy. That's pretty easy to understand that would be not difficult to do over a phone or over an iPad. But what's different about this is the tools, and in pediatrics especially, I can see with this tool I can see in these orifices that I could not do if I were remotely. So this is where the huge advantage comes in.
So there was a lot to do, a lot to refine and get better at, and we think we spent a good amount of time last year working on that, on how we would make this possible, and then try and make it as easy and seamless as possible. So still a work in progress, and we've got a great partner here in the Norristown Area School District.
The partnership really came because as a children's hospital, we're not necessarily in schools. We see obviously some of the patients, the students that go to Norristown schools are patients of ours in specialty care, primary care, but we have not really prior to this been involved with the Norristown School District. So we started this from scratch and started meeting with the school nurses to see if this was even something they were interested in. If so, what kinds of visits were they imagining doing? So we went back and forth with examples of students that were coming to their office and where a telehealth visit might or might not be helpful.
The partnership with CHOP has been awesome. The doctors that we work with, particularly Dr. Bonnie Offit, she's been so helpful. The digital health team, with the backup that they provide and the information and the support, has been a very good working relationship.
And because of this relationship, as me as a physician, a pediatrician back at CHOP, the nurses are even comfortable to call me and ask me questions about anything medical. A student they might have seen that had a problem, and they wanted to just ask me more about that. So it's a new relationship that I've been really enjoying, and I think the nurses have too.
So it was a partnership last year to see if this was all possible, see if we could get people enrolled, students enrolled, parents to fill out the forms, that sort of thing. This year we expanded to the entire district.
We're just very, very fortunate that CHOP, through their network, through their advocacy, was able to secure the funding to get us the equipment to expand all 12 schools. So the telehealth program is now available to all roughly 7,500 students and families in the Norristown Area School District, and we're thrilled to have that opportunity and that that resource available for all of our students and families.
So it has been, because we have such willing partners, there's, you know with technology, it's not turn it on and it works day one. There are things that you have to tweak and keep making sure that the technology is working, but also the workflows. How is this going to fit into the day of the life of a school nurse or a school system? And then again, on the provider side at CHOP, how is this going to work in their workflows?
Really seeing a unique partnership between CHOP and the Norristown School District to provide telemedicine. In a lot of ways, it's the wave of the future, but it's a need that's being met today in the Norristown schools.
And treated right where they are. It's helping with absenteeism. It's helping parents, and as a parent myself, it helps you from missing a day of work, and your child can be seen right there where they are when the care is needed.
The school telehealth program we've been able to implement this past 2 years, partnership with the Children's Hospital of Philadelphia, has been such a benefit to our students and families.
This is the second year for the pilot program, and all 12 schools have machines so they can do telehealth visits.
I think I saw a look into the future. Obviously, our board president, Jay Ash, was kind enough to walk us through kind of what a visit to the doctor's office of the future might look like. But seeing that here today in our own nurse's office, where our students can get the best medical care possible from one of the best medical systems in the region right here in our nurse's office.
For them to get frontline medical care right from the school, and it's really limited the need for students to have excessive absences, or really benefited families as well, that they don't have to wait days and days to get appointments. So again, it's been such a benefit to our students and families in keeping them not only well, but maximizing the time that they're in school and in classes learning.
You know, there's going to be ramifications in the future of telemedicine, everything from insurance to medical providers, how that all is going to work.
We have providers who have signed up from Children's Hospital of Philadelphia to help to assist when children come into the nurse's office and they're deemed necessary to see a provider. These doctors are volunteering their time, so they care and they want to make sure that your child has the best treatment that they can receive. They're not being paid for their services. We have a sign-up sheet and we ask for volunteers, and so far we've had no one say that they do not have the time to help us.
As of right now, it is a completely volunteer program from our doctors at the Children's Hospital of Philadelphia. So we'd like to expand it at any point in time or at a later date, but currently not being able to be reimbursed does limit us a little bit aware how, I guess, the scale of how we're able to provide the service.
Everything the CHOP's doing is free of charge. I know families have to do the registration, and there's, they bill insurance when they can, but there's absolutely no out-of-pocket cost for families to access the telehealth services.
Right now, we're looking at a few options to help expand reimbursement of telemedicine service. In particular, for schools, we would need the expansion of an originating site, so to allow schools to serve as an originating site for telemedicine. And then broadly speaking, telemedicine services as of right now aren't being reimbursed at a full scale. So we'd like to see legislation passed at the state legislative level. So this upcoming legislative year, and we will see if we can get it over the finish line. So we'd like to see reimbursement for telemedicine services.
Definitely telehealth on a larger scale in schools across Pennsylvania. Other states have had success with it. We need the legislation for it to move forward, but definitely helps keep children in school and learning in their desks where that's where we want them so they can learn and be productive members of society.
The reimbursement isn't, it's to reimburse the doctors for their time and their skills and their services. So, if you were to go to the doctor today, you would be reimbursed, or a doctor would be reimbursed. We're asking for the same type of reimbursement for telemedicine services, not necessarily the same rate, just the ability to be reimbursed at a certain rate for the services that are being provided.
Everyone hears about the role of technology, making healthcare more accessible and more affordable. This is a way where we're bringing it into our schools here locally, where CHOP has been gracious enough to provide the service. I was curious, but I also just want to see what the level of quality. I'm quite impressed.
They need the care, and I hope that really resonated, that we're here about taking care of the kids. And so this is a program that will live here, and we would hope to expand, offer additional services here, be able to address other schools as well. And we're hoping that he heard this is a great value to the schools, to the children here, their families, and it's something CHOP's really invested in, trying to figure out ways to get out into the community and be able to offer our services in a broader way.
This really is the wave of the future, and this conversation, I think, really sets the stage for conversations that we're going to be having not just in school districts, but really across the Commonwealth as we talk about how to provide quality of care in the most efficient and accessible way possible.
If families are interested to sign up, we have online registration available. You can go to www.chop.edu/schools to do an online registration, which will take you about 5 to 10 minutes.